kind of was messing up in the return game last week, too, so I wonder if you can attribute it to that some.
Baltimore Game Day Uncensored pregame show. Let's take a look at the injury report.
Injury Report is brought to you by Orthopedic Associates of Central Maryland. In pain? Contact the experts at Orthopedic Associates of Central Maryland at mdbonedocs.com. Care this good feels good to the bone. Injury Report.
And joining us now, Dr. Scott Adams. And Dr. Adams, I hope you had a Merry Christmas. Happy New Year to you. Let's get to Lamar Jackson, who we've gone from, we're hoping it's not a high ankle sprain, so good news, low ankle sprain. Now we're hearing it's kind of a bone bruise. We saw him practice on Wednesday, did not look good. Your best guess, what's going on with him?
Yeah, I think it can still be both an ankle sprain and a bone bruise. When the mechanism of injury that he had caused his ankle to roll out, so you stretch the ligaments on the one side and then the two bones hit together on the other side, and so you can have a bone bruise and a sprain. I mean, in the best case scenario, it is an isolated bone bruise because once that heals, it is 100% better, and there's not a whole lot of risk of anything worsening or re-aggravating unless he has the exact same injury. However, when you look at the play, I have to think that there is definitely a ligament involved, and that's probably the limiting factor at this point.
And I'm assuming at this point, look, regular season ends next week against the Steelers. We all saw the video of him really hobbled at one winning drive.
Sure, the Ravens were thrilled that came out.
Exactly. Yeah. I'm assuming this isn't something that is going to get significantly better in a week.
Yeah, it seems like there's still a lot of healing to go when you see that footage from last week. And, you know, for a player like Lamar Jackson, he needs to be a lot better along in his recovery than he looked in that video in order to perform like he did. If he's someone that just stays in the pocket and can just throw it, you know, you can probably get back quicker. For someone who relies on his agility and speed and ability to avoid the tackle, there's just seems little chance that he in the next 7 days is going to be dramatically different to be able to do that.
Doc, let's go to Devin Duvernay, who was dealing with an ankle of his own. He did not play last week. He's active this week. So am I to assume just like a minor ankle sprain here?
Yeah, I think so. I mean, when you look at these injury reports, when it talks about something like a joint and it says either questionable or doubtful, you can rule out the bad things because you know the things that are definitely going to be out and there's no debate there. So the fact that from the beginning it didn't seem like it was that big a concern, you think like a simple grade 1 ankle sprain or maybe a contusion or bruise, but the fact that he did come back so quick tells you it was definitely on the minor side.
Adafe Owe, he didn't practice all week long with a foot injury. And we were just talking about this with Mike Preston prior to the break about the rookie wall. And you're going from college to playing more games in the NFL and the draft process. What are your thoughts on the rookie wall? Are they more susceptible to injuries in that rookie season?
I think it depends. I mean, not only are you playing more games, but you're also up against typically bigger, stronger, faster people. You know, the college probably has the whole spectrum of people from someone much smaller than you to much bigger than you. So you are just taking, I think, stronger hits, bigger hits. Also, you're now kind of in a whole different league in terms of skill. So you do wonder if that plays into it, but at the same time, I mean, foot injuries and football are very common, so it could possibly just be bad luck for him, but you do wonder if maybe it's just getting used to a whole new level that you didn't see in the college game.
Doug, and I'm going to preface by saying I know you don't know what's going on with him, but I got to ask you about Dalton Hayes, who it seemed like he was going to be ready for the start of the year, then he wasn't, then he was finally ready for, I think it was the Lions game, played about a quarter and was out again, and then was out for a while, and then they said he was getting ready to come back, and now he's been declared out for the rest of the season. It says knee. What's your best guess on what's going on there?
Yeah, sure. You wonder. I mean, again, you can probably rule out things like the dreaded ACL conversation because that's not something where you start and then stop and then start and then stop. That just would have been out from day one. So you wonder, arguably the most stubborn condition in the knee is a cartilage injury. So perhaps he had some small cartilage injury on MRI or on physical exam. And then I read that they talked about he had some procedure. Nowadays, procedure used to mean surgery, but now procedure can mean all types of things. That can be as simple as like a cortisone injection to something like platelet-rich plasma or stem cells. And so nowadays you hear procedure and you really have no sense of what exactly they did. But I wonder if in this setting he did have something where it was trying to nurse him along through the season and basically said, if it doesn't hurt, you can play and we'll deal with it at the end of the season. And that could be something like a cartilage injury. It could technically be like a small meniscus tear that you can try to just get through the season and then on the first day of the off season treat. But it's probably not like a stress fracture in the bone. It's probably not an ACL or other high-grade ligament injury because those are the things where you're not going to try to go. You're going to have to be 100% before you even attempt.
Well, I'm going to plead ignorance on this, but Anthony Averett suffered a fractured rib in last week's game against the Bengals. When it comes to cracked ribs, is that just pain tolerance? Or?
Yeah, great question. Most of the time it is. I mean, first you need to rule out that very rare case where it causes a more significant injury. Make sure that it didn't pierce the lung and cause a collapsed lung. But you can usually tell those because they're going to look a lot worse off. And then it really is a pain issue. And then you take something that hurts even if you're just breathing in your house watching football versus going out and playing. So it is a very painful injury when you injure a rib, and it's just a matter of getting that pain under control. Most of these rib fractures aren't something that requires anything aggressive to fix, but they just really hurt, whether you're breathing heavily or you take another hit to them, and that's just pain.
It just hurts to move, doesn't it?
For sure.
Dr. Scott Adams, as always, thank you so much for your time, and once again, Happy New Year.
Thank you, guys.
It's Baltimore Game Day Uncensored pregame show. Ken Wyman, Tim Barbalace, Mike Preston rejoins us. When we come back, we will climb the depth chart. We'll go behind enemy lines, and we will go and check our look at the weather for the first time with interim weatherman Tim Barbalace. That's coming up next. It's Baltimore Game Day Uncensored pregame. We're with you till 1 here on The Fan.
Fall is here, and that means one thing. Jameson Ginger in Game Time. Whether you're catching the game